In this video, I'm going to teach you how to maximize patient communication skills with the 4 guiding principles of motivational interviewing. My name is Dr. Joe Camerato. I'm with Across The Continuum, and my goal is to make you a better strength coach as a physical therapist. What we're going to be going over today is called motivational interviewing, and one of the first questions that we need to answer is, what is it and why do we need to use it? Motivational interviewing is a style of communication where we're trying to elicit the motivations of the patient that we're talking to determine what sort of behavior changes need to be made and how we're going to make them. Patients come with their own good motivations for making change, and pulling those motivations out of them can help us get on the same page as them. Now, the other part to this question is, why do we need to know motivational interviewing? When it comes to making change in the medical world, behavior is really the thing that we are after. And I've talked about this in other videos, like the technique rebuttal video. The thing that we're after is trying to figure out what sort of behaviors this person is doing or what they're not doing, and figure out what we can bring to the table as far as our understanding of the musculoskeletal and the medical world, and bring them to the same page as us, or try and massage the behaviors that they are or aren't doing into a good direction. Now, most commonly they're leaving something out, like not being active enough, not sleeping long enough, or not having the right mix of macronutrients or nutrition in their life. Now, whatever behavior they are demonstrating that might be contributing to what it is that they're coming to see you for, it's in our best interest to understand that, as well as understand the motivations for them coming to see us and where they're trying to go. There are 4 guiding principles when it comes to implementing and understanding motivational interviewing, and they spell out RULE, R-U-L and E. First, we have R, and that stands for resist the righting reflex. You as a physical therapist are an expert in the musculoskeletal world. You went to school for anywhere from 4 to 8 years sometimes, and you have this very intricate and wide knowledge of the musculoskeletal system, which means that you have a lot of answers. Not only do you have a lot of answers, but you have a lot of desire to help people. This is a helping profession. Now, with a lot of answers and a lot of desire to help, we can be very gung-ho on trying to make changes that we feel are right for the person in front of us who's asking for help. What this situation ends up doing is creating a righting reflex, where we see somebody going in a weird direction, or maybe a direction that we don't necessarily agree with, and we want to really make a direction change for them, or make a recommendation that is going to send them in a better direction in our own opinion. Why this is the first letter of RULE in motivational interviewing is because that righting reflex can have a backfire effect, or can have a negative outcome for us. When people feel like they are being persuaded or sold on something, they tend to recoil, or they tend to shut down a little bit when it comes to accepting any sort of outside recommendations. And when we're on the outside making a recommendation, trying to get them to be open-minded, having them recoil is the opposite thing that we want to happen. Not only is it the opposite thing that we want to happen, but we don't need to make changes immediately. This is a process, it's a behavior change process, and if we can drag it out a little bit more, what we can do is we can build rapport, we can demonstrate authority, and we can build a friendship with the patient that we're trying to make changes for, especially considering that very few people are going to take your righting reflex and make the changes that we're hoping that they will. The next letter that we have is U, and that stands for understanding their motivation. Now, if your motivation is to continue to receive great information like this, go ahead and subscribe to my channel below. One thing that needs to stay at the front of your attention is that the patient's own motivation is the only thing that's going to make their behavior change. Not your motivation and not anything else, just their own motivation. Now, it's this understanding that helps light the pathway for us to walk with them towards their goals. If you don't fully understand this, or don't have this understanding, then you're going to be on a different page than them, or the recommendations that you make might not match up with their own motivation, and nothing's going to work. Not only that, but you can't really grasp the details of the situation when you don't have a full understanding of what it is that they're looking for. There's even utility in asking the person themselves what they feel like is the best path forward, because they're the expert on their own life. They understand the nuances of their days, as well as what it is they will or will not implement. Not only do they likely have the answer, but letting them say it out loud and vocalize it is going to help to solidify the importance of that, because the things that people say get reiterated and solidified in their own understanding of what it is that is important. Next, we have L, which stands for listen to them. Now, listening is a difficult clinical skill to develop. As I mentioned before, you are a bank of knowledge. You're an expert in the musculoskeletal field, and what we need to make sure that you're not doing is cutting in or butting in on what it is that they're saying. We need to wait and listen. Butting into a conversation 20 seconds into what they're saying to give your 2 cents is not listening. And the majority of physical therapists as well as medical providers unfortunately do this. Often the answers that we are looking for lie in their own answers to the questions that we're asking them. And so we need to listen and make sure that we are aware of those bright spots or the things that we can grasp onto to use to reach the goals that the patient is here motivated to reach. And again, if we can understand that we are trying to utilize and grasp onto the patient's own motivation, that can only help us out when we're trying to reflect that back to them to make those behavior changes that we know are good for them, but they might not know just yet. And if they vocalize the change that needs to be made when you ask them about it, then we can just agree with them and say, yes, what do you feel like is the best way to implement these changes that you just talked about? Finally, we have E, which stands for empower the patient. Your patient is much more likely to make changes if they're an active participant in those changes. Yes, you can give a blanket recommendation that may work on a certain small percentage of your patient population, but remember that patients are all individual and they all have individual nuances of their lives, and they are the experts of those nuances. They have the insight on how this change will or will not fit into their life and what changes they are or aren't willing to or able to make. We can make a recommendation of going to the gym 4 times a week for an hour each day, but if they don't have that sort of time or they're not willing to dedicate that amount of time, then it can fall flat. So involving them in the process is going to be paramount here. We want to empower them. We want to put the power into their own hands so that they can make those changes. Remember, it's not about us, it's about them. Now let's go back over the 4. We have R, U, L, and E. We have resist the writing reflex, understand their motivation, listen to them, and empower them. Now, if you can get these 4 down right now, today, you can implement them for your next patient for tomorrow. And I guarantee that you'll be impressed by the changes that you see in your patient interactions and your patient communication. You might even be surprised by the changes that they make when you take their own words and repeat them back to them in a helpful manner. Now, if you found this video helpful, I really think that you'll enjoy the technique rebuttal video that I recorded a couple weeks ago. I'll go ahead and link it somewhere here. Now I want you to go ahead and watch that one because I think that the motivational interviewing and the technique rebuttal pair beautifully when it comes to patient communication. And as always, if you found this video helpful, go ahead and share it with your coworkers and comment below on what it is that I missed or what it is that you agree with or disagree with.